Yes, I think that study between cisplatin and PPAR combination clearly shows how PPAR can improve the results of chemotherapy and immunotherapy combined. Because PPAR can protect the bone marrow. So it is the bone marrow where blood cells like our immune cells, immune cells are being developed and produced. So with the protection given to the bone marrow, the immunotherapy will work better.
Hi everyone, welcome to another episode of Simply Healed, and today we have a very special guest, which is our oncological surgeon, Dr. Jimmy.
Hi Sir Sean, and hi everyone.
And today's topic is about lung cancer. So it's really interesting because today we have Dr. Jimmy with us, and he's an oncological surgeon. So, but Dr. Jimmy is also prescribing and administering chemotherapy. So it's so nice to have an oncology focused perspective on our program today. And Dr. Jimmy actually prescribes, you administer chemotherapy at Manila Medical City, right?
Actually, I do surgery most of the time, but I can also give chemotherapy.
So this is a great time to ask questions with regards to chemotherapy and surgery. But back to the original topic. Doc, lung cancer. How common is lung cancer in Philippines?
In the Philippines, lung cancer is the #1 cause of cancer among males.
Among males? Wow, I thought it would be colon or prostate cancer, but lung cancer is very high. And Doc, lung cancer is something to be concerned about. Am I right?
Because it's deadly.
How deadly is lung cancer actually?
Actually, the 5-year survival of lung cancer depends on the histology. We have two types of lung cancer. We have the non-small cell lung cancer and the small cell lung cancer. For the non-small cell lung cancer, the 5-year survival rate is only 26%.
Wow, 26%.
Yeah. But for small cell lung cancer, the 5-year survival rate is lower. It's only 7%.
7%. Those are very difficult odds. So it's so important, Doc, then to discover lung cancer early. Is it easy or difficult to discover lung cancer early?
It's actually difficult because most of the time, patient will only have symptoms of hoarseness, a little chest pain, mild chest pain, sometimes a weight loss or recurring cough.
And then those are very like normal symptoms for like flu or even general
They will just
fatigue.
consider it as a flu symptom or sometimes irritation.
So they will ignore it.
Yes, they will dismiss it as just a simple pulmonary manifestation.
Will early stages of lung cancer, like stage 1 and stage 2, where it's more treatable, will it actually appear on, let's say, an X-ray of your lungs?
Sometimes, but sometimes it will not.
Okay, sometimes it will not.
Yes.
So it's not a sure way to discover your lung cancer.
Because chest X-ray can only detect tumors maybe as big as at least 1 to 2 centimeters. But if it's smaller than that, it will not detect the tumor.
So if a tumor if you have lung cancer tumors in your lungs and it's already 1 centimeter, rough gauge, what would you say that stage will be already?
It still depends if there's spread to the lymph nodes, the regional lymph nodes, as well as to the other parts of the body. But if it's only the tumor, it's only stage 1.
Okay, so there's still a good chance. And one of the common causes of lung cancer is basically air pollution, and the #1 cause is smoking, including secondhand smoke.
Yes, 80% of lung cancer is related to heavy smoking. The remaining 20% is related to pollution like diesel fumes, secondhand smoke, as well as radon and asbestos.
And Dr. Jimmy had advised me earlier, because I'm approaching that age, which is 50. Okay, for those who are above 50 years old and you are a heavy smoker, or you've been working in an industry where you really breathe in a lot of these air pollutants, right? Then Dr. Jimmy suggests that you can consider having a CT scan, an annual CT scan. That of course is in combination with if you have some
especially if you have symptoms.
So again, if you're over 50 years old, you're a heavy smoker, you work in a polluting industry, and you have some of these symptoms, do consider going for more than an X-ray for your regular checkup. You might ask your doctor if you are advisable to go for a CT scan. Alright, and if you're not sure and you don't know which doctor to go to, just give us a call, put a note right now, then you can always come and consult Dr. Jimmy, who will be able to help you decide whether you should go for a CT scan and definitely be ready to help you in any treatment if the scans come out positive. So, Doc, when it comes to the treatment of lung cancer, what is the most common treatment? Is surgery even common in lung cancer?
There are many treatment modalities for lung cancer. For early stage lung cancer, they can undergo surgery. So for more advanced lung cancers, the treatment options are radiotherapy, chemotherapy. We also have immunotherapy and targeted therapy. And I will also add palliative therapy, especially for those, let's say, very advanced or terminal cases of lung cancer.
I think this is important to note that treatment of cancer is also about quality of life. Yeah, and that it's not only just about treating a cancer, and difficult as it may be. Lung cancer is a very aggressive cancer, and sometimes the prognosis is not pleasant. Not pleasant. Am I right? I was under the impression that late stage lung cancer, by the time you see your doctor, and if it's stage 4, 5 to 6 months is not unreasonable.
Actually, we tell them the average life expectancy, especially with stage 4 and with severe symptoms already, around 6 months, 6 to 12 months.
So at that point, for those of you who have family members that are in that very difficult position, not all options is lost, right? We still go for treatment, and you should consider palliative treatment.
Palliative treatment.
Yes,
to improve the quality of life, and also sometimes it can lengthen the lifespan of the patient.
All right. Okay, Doc. Let's go to positive treatment of lung cancer. So chemotherapy. What are the common classes of chemotherapy drugs when used for lung cancer?
Okay, the most common chemotherapeutic agent used for lung cancer are the platinum-based agents like cisplatin or carboplatin. But there are also other agents like the taxanes and the likes.
Now this you guys may not know, but it's very important to know because of all the chemotherapy agents. Simply Nature PPARS has actually been tested on platinum-based chemotherapy drugs. Specifically, we've tested it on cisplatin and also oxaliplatin. But the main trial was on cisplatin, which is exactly the drug that Dr. Jimmy had just shared. And the result was that we protected the bone marrow from the chemo toxicity. So that means all the negative side effects we are concerned about for chemotherapy drugs. Well, if it's platinum-based like cisplatin, we actually tested our liquid extracts on it, and it did amazingly to protect the bone marrow. And that is going to be very important for the next type of treatment, which is immunotherapy. Doc, maybe you could share with us in simple understanding, how does immunotherapy work? Is it like chemotherapy where it attacks the cancer cells directly?
No, actually, immunotherapy works indirectly. It doesn't attack the cancer cells on its own. It actually strengthens or boosts the immune system of the body for it to develop, to increase its capacity to kill the cancer cells.
Doc, in that case, it's also common that immunotherapy is very often combined with chemotherapy.
Yes, it can be given together with chemotherapy.
So many times we will give chemotherapy first because, okay, if a patient is going for immunotherapy, why would they have to do chemotherapy?
Because of the different mechanism of actions. So they actually work synergistically. One is to attack all the rapidly dividing cells. That's for the chemotherapy. No? To attack the rapidly dividing cells, but it will not discriminate between the cancer cells and the other rapidly dividing cells of the body. So chemotherapy can also affect the normal cells of the body. On the other hand, immunotherapy will act on the immune system of the patient to boost its capacity to develop like the T helper cells to increase the capacity of our own immune system to attack the cancer cells.
So there you have it. Even though there is immunotherapy which has less side effects than chemotherapy, chemotherapy is still very effective because it's a direct hammer. It's like me punching you and Pacquiao punching you. Very, very different impact, right? So, Doc, it seems to me that chemotherapy's action is a little bit in direct opposition to the immunotherapy because, as you mentioned, chemotherapy also damages the body's healthy, rapidly dividing cells. So, would you say that Simply Nature PPARs is like a perfect combination, especially for cisplatin, because we actually protect the bone marrow and everything that's important to the immune system, so that when you finish your chemotherapy and you start your immunotherapy, your effect of the immunotherapy will be better because your immune system is intact?
Yes, I think that study between cisplatin and PPAR combination really shows how PPAR can improve the results of chemotherapy and immunotherapy combined, because PPAR can protect the bone marrow. So it is the bone marrow where blood cells like our immune cells, immune cells are being developed and produced. So with the protection given to the bone marrow, the immunotherapy will work better.
Wow, that's a very good technical medical insight. So now you know that you can get more bang out of your buck, you get better results for your chemotherapy and immunotherapy if you will take additional steps. Like for example, taking Simply Nature PPARs to protect your immune system during the chemotherapy phase, especially during the chemotherapy phase. So again, I can see there are many questions coming up that everybody's probably asking about chemotherapy. Common question, do they really have to take chemotherapy? Can they avoid chemotherapy? You know, this is why we're very happy to have Dr. Jimmy. Wow. So, you know, there is never a doubt, you know, in any doctor's mind, even a naturopathic doctor, you know, they will always have to concede chemotherapy works to kill the cancer cells. It's just that some patients, actually a lot of patients have varying degrees of side effects, and some are so strong that they can't take it. But it doesn't change the fact that chemotherapy is very effective in killing cancer cells. Now, as you can see, we can solve the side effect issues, minimize it, so you can be brave, you don't have to be afraid. You can go for a chemotherapy and do well. That means that you are the best, most aggressive weapon, I guess. You can use the most aggressive weapon, which is your chemotherapy on your cancer, and still be well, be fine, because there'll be Simply Nature PPARs to protect you from the side effects. Alright, so I can see, yeah, a lot of questions are coming. So, Doc, any last advice for our viewers out there, especially anything about cancer? Yeah.
I think since we're talking about lung cancer, my advice would be for those who are heavy smokers. Yes, especially those who are 50 years old and above. If you are feeling any symptoms of prolonged cough, chest pain or chest heaviness, consult a doctor. So you might not know what you have, no? So, and also for those who you have symptoms, even if you're not 50-year-old, especially if you're exposed to very high pollution areas, you have to consult a doctor so that you can be diagnosed properly and be treated accordingly.
So if you're above 50, as Dr. Jimmy said, you have some of these symptoms, don't be so casual about it. It can be simply solved by going for a more comprehensive diagnosis like CT scan. Alright, then at least you have a peace of mind. Alright, so with that, let's go to our next segment, which is the Ask Me Anything segment of our program today.